Good afternoon, everyone. Welcome to today's webinar. It's a collaboration between the Center for Health and Bioscience at Rice University's Baker Institute for Public Policy and the Open Rice Initiative at Rice University's Glasscock School of Continuing Studies. I'd like to thank everyone for joining us online. My name is Kirsten Matthews, and I'm the Baker Institute Fellow in Science and Technology Policy. I'll be hosting today's session on the pandemic titled Schools and COVID-19, When to Return to Normal. The discussion today will be organized around a question and answer with our two speakers, including questions submitted in advance, as well as those that you submit during the event. We have two featured guests today. Our first is Dr. Peter Hotez, the Baker Institute Fellow in Disease and Poverty. Dr. Hotez is the Dean for the National School of Tropical Medicine at Baylor College of Medicine and a professor of pediatrics and a professor of molecular virology and molecular biology. Dr. Hotez holds an MD and PhD and is an internationally recognized physician scientist with expertise in neglected infectious diseases and vaccine development. Our second guest this afternoon is Mr. Zeph Capo. He is the president of the Houston Federation of Teachers and the president of the statewide Texas American Federation of Teachers. Mr. Capo is a public school science teacher and has served as an elected trustee for Houston Community College and several community boards. He attended community college and received a degree in international relations from Florida International University before beginning his teaching career. I'd first like to thank both of our guests, Dr. Hotez and Mr. Capo, for joining us today. I'm going to start our conversation first with Dr. Hotez, and let's start with kind of more of a status quo about the pandemic. So a little bit of kind of figures. As of August 7th, the 7-day average for COVID-19 cases in the US was approximately 54,000 daily, which is down 15% from the previous week. So that's a positive, with approximately 1,000 deaths a day, which is also down, although that still seems significant. In Texas, the number of cases daily was between 5 and 10,000 last week, which is also down from a high in mid-July of 15,000 daily. So both of these numbers indicated that we peaked. How promising is this news? Has the outbreak, the risk declined because we've had this peak since it's been in local as well as in national outbreak, or can the number of cases really kind of surge again in the future?
Well, we could take me a couple of hours to answer all those questions, but let me see if I can give you a few trends here. First of all, I think overall, if I look at the U.S., we've sort of plateaued, maybe we've gone down a little bit, but we've plateaued at quite a high level. So that unfortunately, the United States right now, over the last 7 days and the 7 days before that, and the 7 days before that, and the 7 days for the last few months, has led the world in terms of the number of new cases and the number of new deaths. So the number of new cases has gone down a little bit from the 50 to 60,000s compared to the 60 to 70,000s. But heard from Bob Redfield today, the CDC director, we better watch out because we think that's going to go up again in the fall. That's number one. And number two, the deaths are still awful. And yesterday, the US had the single largest number of deaths it's had since that first big peak in March and April. So what happened was we were doing pretty well into May, into June, bringing it down to around 500 deaths per day, which was still pretty high. And then the week after that, it went to 600 deaths per day, and then 700. Then you get the idea. Then we went up over 1,000, and then 11. These are 7-day rolling averages I'm talking about. If you look at the graph, it always looks like little peaks, but it's always going up. And then it's around 1,100 deaths per day. And now yesterday we were at, I think, 1,500 deaths. So the deaths are mounting, and that gives me a lot of concern. So, and nationally, when you look at the epidemic, it's overwhelmingly right now in the southeastern part of the United States. So Louisiana, Mississippi, Alabama, Georgia, the Florida Panhandle, moving up into Tennessee along the Mississippi River. This is sort of the epicenter. And remember, the US is already the epicenter of the global pandemic. So the southern United States is the epicenter of the epicenter, which is not good. And in terms of Texas, there's been a lot of weirdness with the numbers lately, and you might have heard it. I was on CNN this morning talking about it, and they were asking me about it, and I was I was I was a little bit like Ralph Cramden from, this is before your time, Kirsten. He used to, when he didn't know how to answer, so he'd say, hamana, hamana, hamana. Well, I was hamana, hamana, hamaning, because there's just weirdness in the numbers that I don't quite understand it yet. I don't think anybody really does. The positive testing rate in Texas has shot up to around 24%, so really high, and it's been going up for a few days, yet the amount of testing has gone way down. So I don't know if that's because we're only starting to test more symptomatic individuals, or people are getting frustrated waiting in lines for testing, that they're not showing up for testing anymore. So that's one issue. Then the other is the fact that here in Houston, if you look at the numbers in Harris County, and you might say, where do I get these numbers? Well, there's a few places I go to. Houston Chronicle's got a very nice Texas and Houston portal on their COVID-19 site. And also the Texas Medical Center is a very nice portal. And what you're seeing in Houston is the number of new cases seems to look like a bit of a roller coaster ride. So it's a bit of a Loch Ness monster snake. It's going up and down and up and down and up and down. But overall, so I mean, if you were to cut a line across it, it's at a plateau. But as I said this morning, it's plateauing at 1,000 miles an hour. It's still, between 1,000 and 2,000, roughly around 1,500 new cases a day. And that's confirmed cases. And we know that the confirmed case is always an underestimate, and people have different ideas of how much of an underestimate it is. Some people say times 5, times 10. So we're looking at anywhere probably between 6,000 and 10,000 new cases a day in Houston. That's really high. Now you might say, oh my God, the sky is falling. But the other weird part about the Texas data is when you look at the TMC, Texas Medical Center hospitalizations, and from those of you listening outside of Houston, Texas Medical Center is the world's largest medical center. It's a medical city of 60 institutions, 100,000 employees. Most of the major hospitals are in the Texas Medical Center. The hospitalizations are going down. So even though it's plateaued at this really high rate, the hospitalizations are going down. So it's just created a very confusing picture to provide us. In the past, when I've done these Baker Institute seminars, I've tried to give people a synthesis, because this is what I always throw stones at the White House Coronavirus Task Force, because they give you all these facts and factoids, but they don't provide a coherent synthesis to help you make sense of what the heck's going on. And that's what I've been doing on national TV. But I have to confess, I'm struggling to figure out how to do this, both for Houston and Texas, because the numbers, just a lot of inconsistencies. And I'm guessing they'll sort themselves out. The one glimmer of hope maybe is, if you look at the roller coaster ride of that high plateau of number of new cases in Houston, going up, going down. Right now we're on a downswing. And if I have an extra glass of wine at night, I like to see that maybe it's really starting to go down finally. But I don't know that for certain. And why do I think that's so important? The big reason this is so important, and then I know I over talk, but I just want to give kind of the big picture of what's going on is, and then I'll stop and then we can have more Q&A, is the big thing that's unknown from my perspective is the wearing of masks. No one doubts that masks will prevent the number of new cases from going up. And if we had masks on everybody back when we reopened a few months ago in Texas, we wouldn't be in this situation. To me, the big unknown is whether everybody wearing masks is enough to really crank it down, or whether we still need to go to a lockdown. And that's because we really haven't seen a lot of evidence for that. Just wearing masks actually bring it down. I think it's preventing it from going sky high as it was, but I don't have a sense of whether it's going to bring it down. So
your take-home message is that the masks are positive, but whether or not they're really going to keep it from having another peak or a surge, or.
Well, no, I think it'll prevent. I think the mask could help prevent it from going back up. What I don't know is if we're still at that screaming high level, and this gets into the whole reason we're doing this today, whether you could still open schools, and if wearing the masks is not going to bring it down to the point where you can safely open schools, do we have to go to the L word? And I know nobody likes that, and there has a lot of economic implications and everything else, but that's why I'm looking at it very closely, hoping that those numbers really start to drop just with the masks alone, or whether we're going to have to go to that extra measure. And I think we will, but I'm proven wrong.
So I also want to get my other guest in here. So Mr. Capo, so you have an organization that represents teachers in Houston as well as statewide, and being a teacher yourself, and as we talk with others, first I would like you, if you could explain your organization to us all, but then if you could dig into a little bit, I know we're in the middle of an outbreak in the United States, in Texas, in Houston. Are the teachers and administrators worried about in-person classes? And really, can you tell us what some of the biggest concerns that they're having right now?
Sure, thank you. First of all, thank you to the Baker Institute for this opportunity to come speak with you today. And Dr. Hotez, as a middle school science teacher, it's really cool to be on this panel with you. You're actually one of the trusted voices that many of educators are looking to when they're trying to figure out these numbers and understand what's going on from a medical perspective. You know, my organization represents approximately 65,000 non-supervisory public education employees across the state of Texas. Roughly around 15,000 in the Houston, greater Houston area, and 6,500 in Houston and Spring Branch. We range from teachers in the classroom to paraprofessionals, food service workers, bus drivers, custodians, transportation employees, many of the folks that have been on the front lines of this as it relates to schools from the very beginning. We hear a lot of talk back and forth. Are people working or not working? Teachers are working just as hard as ever, if not harder, frankly, from a virtual standpoint, because they've had to completely retool everything they do into this absolutely new paradigm. But our food service workers never stopped making sure that our kids received food as long as schools were open doing that. Our transportation and custodial workers have actually had to be in schools working throughout the summer to try to make things safer, to the point where we've had in the Houston area several of our custodians that have passed away from COVID-related issues. So this is definitely something that's very much on their mind, some real concerns that they have about the potential return to school, especially in school districts where they may be wanting to bring all staff back at once. You know, some of our schools and campuses could have staff members that are 200 to 300 people deep if they brought everyone who's assigned to that work location back together. And many of our districts in the Houston area are starting to do that. Some of the ones that we've seen recently as well, to go to the discussion on masks earlier, that really concern our members, is we've actually had school districts having staff and professional development meetings, say in the library, where you're really condensing the livable, breathable space that they're in for a longer period of time, where we actually have photographic evidence of people not wearing masks in those areas. And because there is this reluctance to enforce mask requirements or really follow what the county and health professionals are saying to us and require that everybody be part of it, there's a deep concern that the individual few that choose not to follow those guidelines are really going to put at risk everyone else, particularly as we start to increase the density of people returning to campuses before we even get to the whether students are returning on top of that.
So just to clarify that point, so are you saying basically that there are school staff coming into the building who are refusing to wear masks?
Yes, sir. As a matter of fact, we've had photographic evidence from some of our members that are coming in where they've started having these trainings within Harris County already. One of the last ones that I picked and put on my social media, I could easily count 3 different individuals not wearing masks in a small room where people.
And is there no peer pressure to say, hey, what the heck you guys think? What the hell you think you're doing?
That's exactly where we come in. Our members that are leaders in our organizations are the first ones to stand up and say, you know, this is not safe and you shouldn't be doing this. And we're trying to help them understand what the best ways are to move forward, to the point where some of them are saying, I'm sorry, these are not the right working conditions. And they're having to choose between really their livelihood and their life as they make these decisions as well, to say, I can't return under these circumstances.
That's incredible. I can't, it's just amazing. And even now we're still having this discussion about masks. It's just awful.
I would totally agree with that.
Just to kind of give you my thoughts on this, in terms of school safety, sort of the big picture that I think I've been pretty consistent about. What I've been saying is, I think school districts all over the country are really working hard and making good faith efforts to put in place social distancing. I'm shocked to hear that about the masks, but overall, I think the schools have done a pretty good job of doing everything possible, putting, through use of plexiglass and creating classrooms that maximize social distancing and try to minimize number of kids in the hallways. And there's been some well-publicized mistakes that have been made. Overall, I think the schools are maxing that out. My big issue is this. I think in many parts of the country, the level of community transmission is low enough where you can open schools. I think, parts of northern New England, New York State, some of the, schools in the Great Plains and Wyoming and where the community transmission is low enough that you can safely open up schools starting now. And I think New York is starting to do that with all of those belts and suspenders in place to make certain that it's being done safely to maximize it. It's not guaranteed, but I think, and especially if everyone is in masks, there's probably a way to do it. My big concern is that when we think about opening schools, we do not adequately consider the level of virus transmission in the community. And for me, what I'm seeing across the southeastern especially, but also across much of the southern United States, is right now opening up schools is a non-starter. That the level of community transmission is so high, even if it's not going up, it's plateauing at that 1,000-mile-an-hour level, that I don't see how you can open up schools safely. I think, and exactly why, I don't think we totally understand it. We know the little kids probably are not transmitting the virus as much, but the older kids certainly are. Over the age of 10, studies in South Korea have shown that. And even the little kids, the paper in JAMA Pediatrics recently shows a lot of virus in the upper airway. But remember, the other way I always say, it's not just the kids. Remember, schools are not hermetically sealed. You have vendors coming in and out of the schools. You have, the bus driver needs to use the bathroom to go into the school. The other parents are coming into the school at some point. So whatever the reason is, it's pretty clear that when you have that level of community transmission, you're going to have teachers get sick, and cafeteria people and the staff in the cafeteria get sick, or bus drivers get sick. And my premise is that if that starts to happen, if all it takes, for instance, in the Houston Independent School District, is one or two teachers to be hospitalized for COVID-19, word will get out and the lights will go out. I mean, teachers will get demoralized, staff will get demoralized, and having those in-person classes will become impossible. So based on that, what I've been saying all along is it's not up to the teachers and the principals and the superintendents to figure this out. Ultimately, it's up to our elected leaders to bring down community transmission. And I think it goes all the way back to the White House. And so and I'm not really a very political person at best. You've known me for years, Kirsten. I'm a pretty moderate in my political views. And it's not fun for me to have to throw stones at the White House. But what I've said and this is brand new for me, so I'm totally out of my comfort zone, is the White House has not been willing to roll up their sleeves and do the hard work to create a national plan to bring community transmission down to the same low level across the country. And rather than own up to that and take ownership and bring it down, what we're doing is telling the teachers and the principals and the school superintendents, you guys figure it out. And it's unfair, and I think it's guaranteed to fail. And we've got to figure out a way to fix that. So the teachers, as we've just heard, the teachers are doing their part. They're responding to the pressures. They're responding to, okay, I have to be virtual. We'll reconfigure it. I'll figure it out. Make the schools safe, and we have to put plexiglass here and there and reconfigure everything. We'll do that too. So they're doing all they can. They're doing their part. But I think it's at the national level, we're not having the leadership to make this happen safely in large parts of the country. And until we figure that out, it's going to be really hard to open schools. And that's why I put out this October 1 plan, which the White House has been sitting on for a couple of months. So now I think it's probably more like a November 1 plan, maybe an October 15th plan, but where we can bring, and I mean, the thing is, it's not that hard to do it. We can do this. We could bring virus transmission down to the same low level in every state across the country. And there's different parameters. Some people define it as 1 new case per 100,000 residents per day, some 1 new case per million residents per day. Some say testing positivity rates less than 1%. There are different definitions. Whatever the experts decide that is, bring it down. And then we can safely open up schools. As I say, some states are already there. New Hampshire, Vermont, they've done the hard work already. They're already there. They can open now. Same with New York State, maybe same with Wyoming. But right now, it's just not going to happen up in northern Florida. It's not going to happen in Georgia. It's not going to happen in South Carolina. It's not going to happen in Louisiana and Mississippi and large parts of Texas. And it's not going to happen in Houston and Harris County, not at that screaming rate of transmission. And it's not up to the teachers to figure it out. It goes way beyond that at this point.
That's fully right. We completely agree. This is one of the issues that we've been dealing with from the beginning is, we've had more of our state leaders and others, and all the way up to the Secretary of Education, meddling in how we should be delivering education rather than focusing on controlling the levels of virus. We can handle how to deliver education, how to catch kids up. And administrators and educators have had to do jobs that they shouldn't have to do because it's not really their area of expertise. Figuring out what the right safety protocols are to be doing these things should come from medical professionals and others that are helping to get that in and done. And if we can get the virus under control, then all of us can go back to some level of normalcy that will get us moving forward.
Yeah, no, I totally agree. And instead, the American Academy of Pediatrics put out a document saying why school is important. They point out the educational benefits, and it goes way beyond education, right? In low-income communities, it's about food security. It's about mental health counseling for adolescents. And then yesterday, the president held a briefing where they basically said the same thing again. And then the CDC director and Bob Redfield and the CDC on their website put out this very long document explaining why schools are important, as if we don't get that. Of course, we get it, right? I mean, I have 4 adult kids, including my youngest daughter, who's got autism and a lot of intellectual disabilities, and no one appreciates the schools more than my wife and I, and recognize the importance. But they sort of stop halfway. So they say the obvious part, all the health and educational benefits of schools, as if anybody's going to argue that. And then they don't take ownership and saying, okay, to fix this, we're going to bring down community transmission to make this all possible. Instead, they say, just let it rip, and a few teachers wind up hospitalized or sick or God forbid even worse, well, okay. I mean, and it's just plain dumb, and it's going to fail, because I promise you, the minute you start having not only COVID epidemics in any of the schools in the southern part of the United States or in Texas, but you have a teacher or a cafeteria worker hospitalized, you think that word's not going to get out? It's going to spread, and everyone's going to be terrified. So when you talk to teachers, especially, teachers my age, I'm 62, they're terrified, and they should be terrified. That's a scary thing, right? And we're not supporting our teachers. We're setting them up to fail. And there seems to be this lack of recognition that, school teachers are, I mean, what's a greater national treasure than our school teacher, right? I mean, this is the thing that holds up our whole society, our educational system and our teachers and our staff, and we're hanging them out to dry. That's when I started. Well, the other reason I started becoming very political, when I saw the low-income neighborhoods also getting decimated, especially here in Texas, the Hispanic neighborhoods just getting decimated. So those two things sort of put me over the edge in terms of, really pointing fingers at the White House saying, guys, you got to fix this. And they still haven't responded.
So yeah, lots of statistics have actually showed that education is actually the best predictor of health and wealth in the United States. Those with more education are more likely to be healthier and wealthier. And this is one of those things that are key, that's key important to everybody. I think everyone knows that the schools and education is important. But there's also an aspect of it that if there's a sick child, a teacher or administrator, they can't actually fill their role if they're going to be sick, and if we're going to keep having individuals that are sick. I know, Mr. Capo, you've talked a little bit about this for other places, but I maybe talk with our audience. Sometimes you've been able to silver line this idea of doing some non-in-person schooling, the online schools. So what are some of the positives that have actually happened from this? And do you think that this will be a good way of engaging students still and getting them to the right metrics that we're looking for?
Yeah, thank you for that. I mean, there's certainly been enough, real concerns. The fact the state is holding $1 billion in our CARES Act funding that schools should be using right now to make our buildings a bit safer, and in particular, do one of the things that we're actually trying to do now, which is make sure every student has some type of device, whether that's a tablet, a laptop, a Chromebook, to be able to make direct connection through a virtual and online system to connect with their teacher and connect with their social workers and other individuals that they may be needed. The fact that it took an epidemic, a pandemic like this, to get us to move to close the digital divide, first of all, was very sad to really recognize, but it is a silver lining that's coming out of this, because I think once we are able to move forward, once we are to be able to get back into a more safe place, you're going to have a tremendous number of teachers who are much more adept at engagement and educational attainment through an online system than we had before. When I think back of when we first closed, right at spring break, almost all of our teachers, their entire spring break, and then we're just learning these new tools, how to adapt their lessons to this new environment. What are the best practices in making this go forward? We've had some stars really rise to the top who have taken to this work, like Ducks to Water. They're providing podcasts and other deliverable materials that are going to be left behind after this in the form of lessons. Could this be the basis of work that we're able to end the summer slide for our students moving forward, because we're able to readapt these and utilize them in a new and different way? They're now connected when they go home. So hopefully once we get past some of the real knuckle-headed decisions that have been made that have gotten us to this very high plateau and are safe, I think that some of the investments we're being forced to make will have some dividends that pay off in helping more of our kids achieve that next level of education that helps them improve their health and improve their family standing.
The other, and I totally agree with that. There was about a month ago, there was an op-ed piece put out by a professor of astronomy at University of Texas, Austin, who's also a parent, Sharda Joji. Forgive me if I'm pronouncing her name wrong, but she wrote this nice op-ed and trying to offer some constructive solutions, even though she's not a professional teacher. She is a professor and a parent. And she's been talking about opening schools for virtual classes, but also taking some of that unused educational space and doing creative things with it, which includes what she calls, and I'm looking down at the piece right now, safe centers for online learning, she's calling it. So for instance, in many neighborhoods where the kids don't have access to high level, good Wi-Fi communication and internet, that you could open up part of those schools for those safe centers for online learning, and especially for some of the special needs students. So the point is, you would have some teachers in the schools, helping kids with their online learning in that open educational classroom space. Special things for some of the kids who need them, and also for some of the mental health counseling, so that in places where you still have a lot of community transmission, most of the learning would be virtual, but recognizing there are going to be holes and gaps for a lot of kids, those with special needs, those with learning disabilities, those who just don't have the electronics at the home, or they're living in low income communities for where they don't have good access to Wi-Fi and computer, and then you use the educational space that way. I thought that was a very innovative idea, and I know she's been talking that up a bit, and I actually wound up having a call with her because my wife Ann pointed it out to me, and she thought it was really interesting, and I agreed. I thought it was really fascinating, and we wound up having a call with her, and I think that, and also the other thing that open educational classroom space could do is even provide meals for the students who rely on the schools for meals. And again, it's a stopgap. It's not the long-term answer, but at least it kind of keeps things going until we can get our leadership to figure out how to reduce transmission in the community.
That's a great point, because there are opportunities, particularly in the public education system, to turn some of our investments that have become deficits recently. For example, we stopped redesigning open schools because of the gun and safety issue. But the many ones that we have right now, we have significant numbers of campuses where individuals can go from the parking lot directly to a classroom without having to be inside a air conditioned space and building. How do we retrofit those rooms with really ramped up filter systems and proper ventilation systems so that they're closed, so that you could put a small number of students that need that face-to-face education the most into these areas, and keep it as safe as possible for our teachers who maybe are a bit more healthy and are willing to take that step forward. If we were willing to refocus how we use the assets that we have now, I think that there are definite opportunities that could align with those safe space schooling opportunities. Yeah.
Do you think that the schools are adequately kind of implementing some of these? You've mentioned they're not seeming to police the idea of masks within it, but how well are they doing some of the other metrics? I know CDC has a 6-foot rule. So visually, even my son, who's only 12, was like, man, how's that going to work? Is everyone going to have a 6-foot thing around them so they could swirl? And if they hit somebody, that means someone's too close to them. How are we going to decrease? We saw Georgia, there was kids all over the hallway going from class to class. How are we going to do that if we insist on everybody? I think the last, and you can correct me if I'm wrong, TEA wanted everyone in the classroom. They weren't really interested in breaking it into smaller groups. I mean, how are these things being worked on through the school system? Or different districts having different plans? Have you heard anything?
Yes, thank you for that question, Dr. Matthews. Let me first say, first of all, and you may not always hear this from me, but Houston ISD in particular has done a really good job with their plan for returning to school in comparison to all of the other plans. And I've gotten an opportunity to look at quite a few, and then places that don't have the depth and breadth that we may want to see in a reopening plan. Even still, though, there are challenges that make it difficult. Not perfect, but probably one of the better plans that I've seen. The unrealistic ideas that we can go back to everybody being brought back at once really puts strains on that. Your son got it right. I mean, he's thinking exactly what the rest of us are thinking. Under normal circumstances, we are penny pinched in the public system to the point where we want maximum number of people in space as we can get them. If you bring everybody back, it's really difficult to social distance, not just in the classroom, but in the passing hallways. And how do you get everybody through the lunch line in the right amount of terms with doing these things? There are tremendous numbers of logistics and systems as large as our public schools that many people don't really think about, that all come in and could topple like dominoes if we're not really careful about it. That's why we've really proposed being strategic, not just bringing everyone back, but being strategic about who you bring back, when, and why. In smaller numbers, our kids in most greatest need, so that you actually get the opportunity to implement these plans with some level of fidelity before you bring in more classes and more individuals, so that it becomes part of the routines, not only for the students, but for the faculty that are there as well too. They have to have a deep understanding of why these systems are put in place, how to properly implement them, how to look out for one another. So if one class happens to be late going into the hallway, you don't fill both classes up and then to the detriment of your social distancing space. How we're really honestly going to be able to social distance on a school bus is frankly it's fantasy in many ways. It's just not going to happen. We have enough trouble with adults complying or working with medically based practices to with the level of fidelity that we need. It's going to be even more difficult with younger kids that really do want that social interaction. We understand that's a huge part of schooling, but how do we prioritize things? There are some times we've been through periods in our history and our society that we have to make certain sacrifices. We have to be okay with not being as comfortable as we normally would. This is one of those periods, and having these artificial constraints that are really trying to put us back to normal in a time and a place that we can't be, actually make it more difficult for us to implement the right way. Even for those that have the best intentions and are in a better place to not have to respond to pressures that want things back the way that they used to be, despite the evidence to the contrary.
Yeah, and I would say, even the 6 feet rule, is, the evidence for that is not the strongest. For instance, an article came out this week from a group at the University of Florida that did sampling of aerosol or air from patients' rooms with COVID-19, and they were able to identify live virus, actually culture virus, from samples collected 4.8 meters away from the patient. So that was about 15 or 16 feet. Now, it's not to say that that would infect somebody, but you can still recover a live virus. So, we talk about 6 feet as though we really know what we're talking about. We really don't. I mean, 6 feet is clearly better than 2 feet, but 6 feet is not as good as 8 feet. And that's really what we know. And so again, this all comes down to recognizing that we can't do this in areas of high virus transmission. Once we bring virus transmission down, then you've got some margin for error, so that in none of these schools will things work completely well. As you point out, there'll be a screw up in the timing of classes, so classes there'll be crowds in the hallway, things won't go well on the bus. That's inevitable, right? I mean, they're kids at the end of the day. And what, especially the little kids, right? I mean, what's going to happen on on day one. Even before the kids go into the classroom, they're going to take off their mask and show it to each other. They're going to trade their masks, or they're going to break the elastic. And then 2 hours later, one of the kids is going to throw up. And then after that, one of the kids is going to get upset and cry. And then what's the teacher's supposed to do? Stand across the classroom with their mask, scary mask on, and point? Is that, they're not going to do that. They're going to comfort the kid. That's why we love our school teachers. So this is why we have to give them lots of opportunities to have mistakes made. I guarantee you, in any classroom, in any given day, there will be a lapse in every class on every day. There'll be a lapse in those safety procedures. And you can't set up teachers to fail so that they're doing this in areas of high virus transmission.
So it sounds like, in a sense, we're actually experimenting in the classrooms. And my question to Mr. Capo would be: Is the state allowing some of these experiments, or they keep pushing you back and trying to shove to the normal status quo from before? And how are teachers reacting to the fact that, in a sense, they're doing experiments? I mean, we already are with the online portion of what we're doing. But are they okay with the idea, or do they prefer actually trying to do it in an experimental way versus going back to September of 2019?
Yeah, I think overall, the vast majority of our professionals in the education arena know that it's just not going to look the same. There's no possible way that it could. We're going to have to do things differently. But this idea of experimentation is definitely on their mind right now. And this is a question I may want to get to earlier. We had a national town hall with Dr. Fauci a couple of weeks ago, and the carryover that came out of that with our teachers across the country was a comment that he made was they're going to be the next experiment in how we deal with COVID. And the answer, or the question that they have on their mind is, if I'm going to unwillingly be the next in the petri dish and the next part of the experiment, how do I mitigate the unintended consequences that I may potentially face in that experiment? That's one thing. I think that experimenting on the other side, the educational delivery side, I think is a challenge, but is an interesting piece that they're very much willing to engage in. We've seen that from the very beginning. The systems in and of itself, however, provide some difficulties and barriers. We've mentioned some of them, like some of the very unfavorable ones are misplaced edicts coming out of the state office where they're going to threaten funding if they don't meet these certain guidelines that they've put down and what have you. Those are not helpful. They're not helpful to superintendents. They're not helpful to school districts as they're trying to work through these pieces. To other regulations, like to trying to make it simpler for parents having to navigate the multitudes of different types of platforms for educational learning. We're restricting those platforms to a certain set for the reason to make it a bit more easily understood and flowable for parents. However, what you do in that case is you close down potential areas of innovation for teachers that have been working through things. They no longer have access to the foundational work that they started in Google Classrooms because they're not allowed to use that form anymore and have to reinvent the wheel somewhere else. So figuring out how you balance all of these differing and competing needs within a system like the public schools, this is another big part of that question on logistics, really get you different answers on that willingness to experiment. I think they're absolutely willing to experiment if they had the time, space, and opportunity to do so without these kind of artificial barriers in the way. But some of these barriers and regulations are trying to solve other problems, like making it easier for our parents to keep up with. So it's constantly doing that balancing rope act for our educators and our administrators that I think keeps us at a tug and pull system. But as Dr. Hotez said, if we could get the state and the national to kind of work on focusing what they need to do, which is working to get the virus under control, that will create a lot more space and time and opportunity for us to just be able to focus on how to retool and revamp our delivery system to the best of our ability.
So I'm going to ask Peter another question. It's going to zig a little bit, but I'm going to actually ask him about vaccines. We talked about this, and if anyone's interested, we talked about it in a lot more depth in the May webinar that we did with Dr. Hotez and Rekha Lakshmanis. But can you give us like a little bit of an update about what's happened since then? I know several of the companies are starting phase 3 trial. And in addition, Russia announced that they had a vaccine. They decided, I guess, to forego or just to start giving it out to individuals while they were doing the phase 3 clinical trial. So could you walk us through, well, first, can you let us know what the differences between the phase 1, 2, and 3 trials? What's going on a little bit about the vaccines right now, when we should start learning things about the US ones, and also just a little bit of your opinion about the Russia announcement.
So sure. So tell me about all things vaccines in 5 minutes. Okay, no problem.
Exactly.
By the way, we put out a press release this morning. So our Texas Children's Center for Vaccine Development at Baylor College of Medicine has a new partnership with India. We're scaling up production of our recombinant COVID-19 vaccine for India with the hope it's a company, pharmaceutical manufacturer in India called Biological E, and they have the ability to make 1 billion doses of our vaccine. It's a low-cost recombinant vaccine. That recombinant protein vaccine uses the same technology for the hepatitis B vaccine that's used all over the world and made locally in India and Indonesia and Brazil and elsewhere. So we think could become one of the first global health COVID-19 vaccines. The issue is this, and we've talked a little bit about this before, the technical hurdle to develop a COVID-19 vaccine is not that high. It's kind of an old school problem in virology. We need to make something that'll induce high levels of virus neutralizing antibody against the spike protein of the virus. And we've all seen the cartoon of the coronavirus with those spikes around it, together with some T cell help. And there are lots of different ways to do that. And so the reason you're seeing so many different platforms of vaccines is we don't know ultimately what's going to work the best in people in terms of protecting against the infection and also showing to be safe. So we think it's going to be best done through a recombinant protein vaccine. Moderna and Pfizer think it's going to be through an mRNA vaccine. AstraZeneca, Oxford, and J&J, and the Russians think it's going to be done through an adenovirus vaccine. Merck thinks it'll be done through a live virus vaccine, and so on. And over the next year or so, as we go through clinical safety trials, we'll be able to figure that out. The hard part is not so much making a vaccine, it's making a vaccine that with adequate quality control and quality assurance, and making one that goes through adequate safety testing in at least 30,000 people to show it actually works and it's safe. And that's where the hard part is. And sometimes, with some of the messaging coming out of the White House, they kind of pose it as a manufacturing problem, just like making ventilators and diagnostic tests. And there are manufacturing issues, but overwhelmingly it's giving that time to collect data on 30,000 people to show that it's safe and effective. Now, what the Russians have done is what they did was they made a vaccine similar to, it's got two components, one very similar to the Chinese adenovirus vaccine, the other one similar to the J&J vaccine, claimed that they've made an incredible technological achievement equivalent to Sputnik, and they even call it Sputnik 5. I think that's the name of their vaccine. And now they're going to ship it all over the world, which shows their incredible naivete, because one, it's not that technically complicated an accomplishment. It's not a great scientific achievement. And all they've done is bypassed all that important quality control, quality assurance, and safety and efficacy testing to release what potentially is a dangerous product. They may get lucky, it may turn out to be okay, but we're not going to know that till it's now being used widespread. And the fact that they're not only making it for Russia, but they're without any kind of World Health Organization pre-qualification sending it potentially to African countries and Latin American countries and sort of some type of Cold War style political influence is really worrisome. So I'm very unhappy with obviously what the Russians are doing. On our side, on the US side, we are, we have all the belts and suspenders for regulatory approval. The vaccine will not be released ahead of the election. In fact, I don't see any vaccines going through. It'll take time for all those vaccines, which have to be administered in at least 2 doses, to go through all the safety testing that is just now in phase 3 trials. The first one is just now started. So I don't see that until sometime next year. And I tend to be on the conservative side. I say Q3, quarter 3 of 2021, before those vaccines are released to the public. Dr. Fauci is more optimistic. He's saying Q1, Q2. So kind of split the difference, and you're roughly looking at the middle of next year. And even then, I like to point out, it's not just a matter of showing which vaccines are work, it's how they work. So for instance, some vaccines may reduce severity of illness, but not necessarily block infection. And so we're gonna have different kinds of vaccines. Some of them will work like a measles vaccine in 2 doses, high levels of protection against infection, so it could create herd immunity. Others might not be as effective. They may be like a flu vaccine in a year where there's not a good match between the virus and the vaccine. In that case, these are not going to be miracle solutions, right? We're still going to have to use masks and social distancing. So I think we have to get over this magical thinking about vaccines. They're going to be companion technologies, not replacement technologies. And one of the problems that we've talked about in the past with Operation Warp Speed is there's been very poor levels of messaging, not really explaining that to the public. And we're going to need to up our game from that standpoint. But I think the exciting thing is the fact that we today made this announcement. This is something our team has been working on for working on coronavirus for 10 years, and with my science partner for 20 years, Mary Elena Batazzi, we're very excited to be able to make that announcement today.
So just to clarify, so we're talking about a couple of them in the phase 3 clinical trial. So you're saying it's a large group, say 30,000 people that are all going to get the vaccine, maybe once, maybe twice. And then what you do is just sit around and wait. Is that what happens? Is we see if anybody gets sick? Is that
for example, let's take the Moderna vaccine, because all of the vaccines in the phase 1 trials with very limited number of people enrolled, it's clear you need 2 doses to get any kind of meaningful immune response. So the first wave of the Moderna people in the trial are getting the vaccine now, and over the next probably few weeks, they'll get up to 30,000 people. And then, so I don't know, I don't have the precise timelines. Let's say September, October, they're all starting to get their second dose. And by December, they'll be, everyone will be fully immunized. And then that's right. They have lives and they're going about their business, and there's some placebo and there's some getting vaccinated. And then we'll see who gets infected, who gets hospitalized, and who's not, and then compare the 2 groups. And that's going to be true for all of those studies.
But they're not going to actually challenge anybody, because I think that's its own set of complicated.
No, I mean, I'm part of the NIH advisory group, vaccine working group of ACTIVE. It's an acronym, and creating a challenge model is not trivial. It can take months or even years to set up a challenge model for reasons I won't go into today because it's too detailed. But it's not a quick fix by any means. So that really is not on the critical path. I think we'll get an answer in a phase 3 trial faster than we will doing a challenge study.
So I noticed our time, and I think I have one question I always like to wrap up these webinars with, and I wanted to get both of your perspectives on it. We've been talking about COVID for a while. You can go online and search it and find like hundreds and thousands of articles about it, and the quality of them are completely different. There's ones that perpetuate myths and misinformation, and I want to know where you guys go for reliable sources of information on the virus and the pandemic. And I'll start with first with Mr. Capo. Where are you guys looking? Where are you pushing your encouraging your teachers? Who are the leaders, thought leaders, besides Dr. Hotez, that you're telling them to kind of follow, and these are kind of reliable sources?
Yeah, a couple of things. I mean, well, first of all, I've got JAMA Current on my Twitter feed, consistently trying to keep up with what comes out of there and pull some of those articles to share and push out to our members. For our Houston, Harris County folks, readyharris.org is kind of a go-to spot that we look at, particularly now. They probably have developed the most clear set of recommendations, circumstances, and broken it down for people to understand. Red, orange, yellow, green kind of a scenario so that people can really get a perspective for things. We also have our national office. In addition to being a educational organization, we're probably one of the largest nurse and allied health employee unions in the country. So we have a significant department there that's able to provide research-based information to us that we share with our members.
What about you, Dr. Hotez? Where would you recommend our audience go for consistent and trusted information? I know science articles sometimes are a firewall, so you can't get to all of it besides an abstract. Are there other places you would suggest that they look at?
Well, the New England Journal of Medicine, JAMA, and the Lancet, the big, flagship journals, PLOS, are all making those COVID-19 articles open access. So you can go there, and I do so. Also, I go to BioArchive and MedArchive. These are preprint servers spelled BIORXIV and MEDRXIV. There's a lot of new and current information. They're not peer reviewed yet, but a lot of important data. And then, to keep up with what's happening in trends in the US in terms of cases and number of cases and deaths and hospitalizations, the New York Times is got a really good site. Houston Chronicle's got a really good site, a COVID-19 tracker. The Johns Hopkins COVID-19 site is really strong. Kaiser Family Foundation. Also, I go on the Texas Medical Center website, the TMC, and usually I try to scan those in the morning and to get a pretty good sense of where we're heading, and that usually takes away your appetite for breakfast after you see all that.
Well, it looks like we're run out of time, and I'm really sorry we didn't get to all the questions from the audience, but perhaps we can bring you both back again as things kind of move forward in the future, and you can give us an update on everything that's going on. I really would like to thank both of you, Mr. Capo, Dr. Hotez, for sharing your insights, as well as everyone in the audience for joining us today. Check the Baker Institute website for additional webinars on COVID, as well as other topics. Thank you very much.
Thank you.
Thank you.
So.
How's that?
Sounded okay, I'm just wondering.
Wait. Kirsten, okay?
It was all good.